It's the hot mic.
We wouldn't be here without this guy this morning.
Hi.
It's true. Have you met? Did you have a chance to meet?
Briefly.
Yeah. Ted.
So he wrote me a note about a huge problem with the Healthcare Act and Medicare that led to legislation.
I was wondering where like the notice is for something.
You're first.
I'll be brief as I always
Well,
am.
It's all good. It's all good.
It's very satisfying.
I think are we ready?
We were.
Here, I'll stand behind it.
It was very satisfying to realize that, Representative Durian,
So if there's something you can go wrong,
it's not just a theory, and that people need them. Even if they think it's silly out there.
So first, I just want to welcome everybody to Vista. My name is Dan O'Donnell. I am a council member that represents District 4. We're here today because of the work that Congressman Levin has done working for the Affordable Care Act, making sure that our seniors, our working class families, those that live in areas that are in the most socioeconomic impacted spaces, not just here in Vista, but all across the country, have access to affordable health care, have access to lower prescription drugs. I'm very proud to be here today because I can tell you just last year my wife gave birth to our first son. And the cost of those medical bills was astronomical. And because we have good insurance, we were able to only have a bill for about $3,000. But just 2 weeks ago, I went to our urgent care just up the road, and a $900 bill to have a few tests done. And at the end of the day, my cost with a high PPO was $250. So what that does and the impact that has on the people that need the help the most, to be able to eliminate that and work with them and lower their costs for prescriptions and for health care is truly a remarkable thing. So I am so proud of our Congressman Mike Levin for the work he has done for everybody across this nation, especially here in California. And so I'm very proud to introduce him now.
Thank you. Well, thank you so much, Council Member. It's great to be with you. For those that don't know, am Mike Levin. I represent the 49th Congressional District, including here in beautiful Vista and all of North San Diego County. I want to thank VCC. They're doing a tremendous job, and they're helping patients not only here in Vista, but really all throughout the region. Having access to quality healthcare facilities and professionals is absolutely critical to improving health outcomes. So I want to thank everybody at VCC for your service to the community. I'm excited to visit your facility here this morning that does so much to help our seniors. We're here to discuss a couple things: congressional efforts that are currently in place, cemented by federal law, to lower health care costs for millions of Californians and Americans across the country. Before Congress passed the landmark Inflation Reduction Act, Americans on average were spending $700 a month on insulin. $700 a year on insulin. $700 a year on insulin. While pharmaceuticals and insurance companies were making huge profits, Americans were paying more and more for necessary life-saving drugs, and in some cases they were even rationing insulin. That's unacceptable, and it's why Congress decided to take action. So together with my colleagues in Congress, we passed landmark legislation to lower health care costs and out-of-pocket expenses, and I want to highlight two specific provisions that are in effect. First is the cap on insulin. For seniors with Medicare Part B and Part D, insulin is capped at $35 a month. That took effect in 2023. $35 a month. So for a lot of people, we're talking about half or even less of what they were paying before. Right now, over 108,000 Californians on Medicare are benefiting from this and paying no more than $35 a month for insulin, with an average $339 annual savings on insulin per person and a total of $36.6 million in annual savings on insulin for all Californians. That's a huge victory for our seniors. Across the country, the cap on insulin is helping 1.5 million seniors save an average of $500 a year. That's real money for our seniors. And that's just for insulin. Second is the cap on out-of-pocket prescription drug spending. Starting in 2025, Medicare Part D enrollees will spend no more than $2,000 out-of-pocket annually on prescription drugs. Over 2.1 million Californians will benefit from this and save an annual average of $295 each due to the cap, and over $644 million total in annual out-of-pocket savings. That's absolutely huge. Across the country, nearly 19 million seniors are projected to save $400 annually on out-of-pocket prescription drug costs. So again, $35 insulin, roughly cutting insulin costs in half for those on Medicare, and $2,000 out-of-pocket maximum for those on Medicare for their prescription drugs, dramatically reducing their prescription drug costs. This is progress. These are real victories for our seniors. And hardworking Americans who need relief from their medical costs are finally getting some relief. But we always can do more. We have to do more. And our system still is too expensive for so many people, as the councilman just mentioned. My constituent who's here, Ted DeBont, you're going to hear from Ted. He recently brought to our attention a loophole in the Affordable Care Act that was causing health insurance premiums to skyrocket, specifically for married households when one spouse has an ACA plan and the other ages into Medicare. Now, Ted and his wife look great, I think, for their age. But one of them, I'm not going to say which, aged into Medicare. And what Ted saw all of a sudden is that his household's overall insurance costs doubled. I'll say that again. One of them on the Affordable Care Act, one getting on Medicare, and Ted's house, the overall insurance cost doubled, going from about $300 a month to about $600 a month. That's ridiculous. And when Ted brought this issue to our office, you have a lot of constituents that write every single day and call and email, and a lot of members of Congress, I think, don't listen and don't read. But I do, and my staff does. And when Ted sent us this note, we said, whoa, this is huge. We got to fix this. And so we dug into it. And as a result, we recently introduced new legislation. We should call it the Ted and Carla DeBont Act, but it's called the Health Insurance Premium Fairness Act. That's a good name too. To cap health insurance premiums for households enrolled in Medicare and the ACA health coverage plans, and we've got to close this loophole that's driving up their premium costs. So I'm actively working to garner more support for this bill. We're working with anybody on either side of the aisle who is interested in working with us on lowering health care costs for our seniors. Since entering Congress in 2019, this has been one of my top priorities. We must ensure that access to quality and affordable health care is available to more Americans, and I'm going to continue to work with my colleagues on either side of the aisle to make this a reality. Now I'm going to turn it over to somebody who does an incredible job for our community, and that's VCC's Chief Medical Officer, Dr. Sarah Fatlin. Doctor.
Good morning, everyone. Thank you for being here today. I'm Dr. Sarah Fatlin, the Chief Medical Officer for Vista Community Clinic. And it's my pleasure to be with you to highlight the positive impact of the legislative efforts of Representative Levin on community health centers like Vista Community Clinics and the health of the patients that we serve. The Inflation Reduction Act, since its enactment in 2022, has resulted in the elimination of cost sharing for Medicare Part D vaccines, notably through the introduction of a $2,000 out-of-pocket cap. This not only provides essential financial protection for Medicare Part D enrollees, but also places a limit on their annual spending for prescription drugs, alleviating financial strains on households, which promotes better access to high-quality health care. The positive effects of the Inflation Reduction Act on community health cannot be overstated. By promoting vaccine access and reducing out-of-pocket expenses, the Inflation Reduction Act aligns seamlessly with VCC's mission to ensure that we can deliver vital health care services to all members of the community. Furthermore, our gratitude extends to Representative Levin for introducing these crucial bills, marking a significant step towards ensuring fairness and affordability in health care. Representative Levin's dedication is exemplified in his sponsorship of the Health Insurance Premium Fairness Act. This legislation addresses a significant loophole affecting married couples experiencing transitions between Medicare and Affordable Care Act plans. By closing this loophole, the Act will prevent financial strain on households navigating the complexities of dual coverage, allowing them to maintain reasonable and predictable health care costs. in its alignment with our commitment at VCC to empower communities disproportionately affected by social drivers of health, the Health Insurance Premium Fairness Act ensures that affordable coverage is extended to more members of our community impacted by these issues. Through these initiatives, we pave the way for a healthcare landscape that is not only fair, but also accessible to all. Thank you.
Thank you, Doctor. Thank you so much. Thank you. Thank you. Thank you. All right, now it's my honor to get to introduce the star of the show. That's Ted DeBont. Ted, take it away.
Thank you, Representative Levin. Well, I don't really have any notes today. Suffice to say that when we first noticed this issue, it was my wife Carla who noticed that our premiums were going to double. And I'm the political guy, so I make the contact. This was something that was a surprise when I got the call that there was legislation written about it, and it really has restored my faith in representative government. I urge everyone to don't hesitate to contact their local, state, and federal representatives, because you may think it's already been covered, but in my case, I would have thought that somebody would have thought of this, but they didn't. And now we have legislation, and I'm just a common person. So I want to thank Representative Levin for restoring my faith in representative government, and I can't say enough good things about him. So with that, let's see if we can get a majorities in the House and Senate and get these types of legislations passed for the American people. Thank you.
Thank you. Well, Ted said thank you, but I told him you can't thank me until we get this to be the law of the land. So we got a ways to go. I think that's all of our speakers. So with that, I'd be happy to take any questions. I again want to thank VCC for coming. Questions? Hearing none. Going once. Going twice. All right. Thank you, everybody. Appreciate having you. Thank you. Thank you. Thank you, Ted.
Did that go good?
Yeah, of course. That was